Well, starting in their late 30s, many women start experiencing symptoms of menopause, including anxiety, depression, sleep issues, and hot flashes. Now, while this issue impacts so many women, there's still very little research or treatment available. A new project out of the University of Alberta is hoping to change that. Joining us now is Dr. Colleen Norris from the U of A's Faculty of Nursing and Maya, the project manager. Good morning, ladies. Thank you so much for joining us.
Good morning.
So, Maya, the first question goes to you. You're opening a new virtual care clinic to help address the gap in the reproductive transition stage. Tell us more about it.
Yeah, so we're collaborating with an amazing team of consultants and nurse practitioners to provide nurse practitioner-led care for women in that late reproductive stage, 35 and over, where we start to experience these symptoms and we don't really know what to attribute it to and how to seek out that care. And so it will be an online virtual platform, but we want to reach women throughout Alberta, so we will also be targeting rural women throughout Alberta as well.
Now, Colleen, why is there such a gap in this research?
Well, part of it is that women weren't included in research because of their menstrual cycles, and the idea was that it was too unpredictable to include them in research. But there's also been no research done in women alone, looking at their reproductive system and trying to figure out what causes what and how do we prevent that and how do we change the outcomes for women.
Maya will be providing women with primary care before, during, and after menopause, but there's a lot of research that's going to go into this. So can you talk specifically about the research projects?
Absolutely. We're collaborating with experts in women's health specific to menopause when it comes to exercise physiology, nutrition, neuroscience, reproductive health, gynecology. And so we're going to create a really beautiful educational platform for these women as well to ensure that they're getting that evidence-based information that they need. And we're also going to collect a lot of historical kind of lifelong sex and gender data from all these women, just so that we can start to create a platform that is evidence-based and really works for women.
So, Colleen, what is the goal of the project and where do we go from here?
The goal absolutely is to create awareness in women that this is going on in their bodies and that it actually affects their heart and their lungs and their kidneys, which we've never paid attention to. And also, we're trying to create a registry where we start collecting this data because no one virtually in Canada is collecting it, so that we can start making these associations between what's happening in your life and what are your health outcomes because of it.
So are you strongly encouraging women from all over Alberta to participate in some of these studies and the research?
Oh, absolutely. We're trying to create a registry of women throughout the whole menopausal transition so that we can start getting some of this data to say, did you know that this happens in your late 30s? Did you know that you can prevent this?
Both of you seem very passionate about the topic. How exciting is it for you as two women who identify as female to be working on something like this?
It's overwhelming to me. We were so fortunate to get the Alberta Health Primary Care Innovation Specialized Care Clinic grant to do this. We've been trying to do it for years and years, and it's like the snowball started rolling.
For sure, and I see you nodding your head, Maya. You definitely agree.
Yeah, I think it's an amazing platform too, where we actually get to start to bring together women's health researchers too. We're bringing in experts from all over, and often women's health is so siloed and fractured. So it's kind of amazing that we get to create a big community to help women.
Well, this is very exciting. Ladies, thank you so much for your work, and thank you for joining us this morning.
Thank you.
The team plans to open the virtual clinic by the end of this year. 300 patients have already registered, with plans to recruit more once the clinic is open.